we will cover the different cups that we can choose to use in our daily application, how to use them, the retention times that we may want to apply for, along with the level of suction that we want to apply, hygiene, which is a very important part, and then a small conclusion as to how to integrate and what is best for you. So firstly, as you can see, we have different types of cup here sat in front of us, made from rubber, plastic and silicone. These silicone and rubber ones work in a similar manner in that we will depress them first, apply to the area, and then as they come up, they will provide some amount of suction. And we can just squeeze to release. And again, with these silicone ones, we will depress and apply, and as they raise back up, they will provide some form of suction. And again, we will peel to release. You can see during the workshops, we used plastic ones here for ease, as this is what we find easier in day to day. And you can see there's a little curvature here on this one, which will lend itself to certain parts of the patient's anatomy. And we need the gun to apply those, we can apply different levels of suction, and then to release, we can just pull this little nozzle here, which allows us to take that off nice and softly. So we can use them in any number of manners, from passive treatments, so having the patient in any position on the bed and working through a range of areas. We can then add mobilisations or even active elements into the technique to allow the patient to get off the table and make the treatment a little bit more integrated. The retention time, depending on your clinic, will be anything from 3 to 5 minutes if you're integrating cupping with different modalities such as dry needling, mobilisations, or if it's a standalone treatment, you may be using the cups for 20, 25 or even 30 minutes. A point to note here is that the longer the retention time, the higher probability of bruising the patient. And again, reiterating the points that we made at some points during the course, more doesn't necessarily mean more, in that the more cupping or the more bruising that we elicit or use does not necessarily translate to a better experience for the patient. So we need to ensure we are working within the tolerance levels of the patient and working to make sure it is a therapeutic session. Another point, as we mentioned, is hygiene. Hygiene is a very important part here, as we want to ensure that infection prevention control is well managed. After using a cup, with every patient, we need to ensure that the inside and the outside is fully disinfected using a disinfectant that is safe to touch the skin. And this is very important, working long hours, long days, seeing multiple patients, ensuring that each patient receives the cleanest cup or hardware that we are using. So in conclusion, have a try of each different type of cup, find what is best for you, which you feel most confident and competent applying, and most importantly, what your patients are receiving, so if it's the most therapeutic benefit. And there's no need to go out and buy the most expensive glass cups or plastic cups on the market, as each cup here, regardless of the makeup, rubber, plastic, silicone, glass, still provides the same benefit. Right? So there's no need to go out and spend more. So to end, ensure that you're integrating this into your daily practice as best you can with other modalities such as instrument-assisted soft tissue mobilisation, dry needling, manipulations, and certainly exercise rehab post-treatment, looking to return your patient to a better version of themselves for the issue